We, as former colleagues in the city council, have been through budget after budget where the mayor makes cuts. And typically the dynamic is the mayor makes cuts and we fight against those cuts because we don't want to see services diminished. We don't want to see unfilled staffing positions remain unfilled. We get complaints from constituents about city services, oftentimes because there's unfilled positions. A lot of those positions that were unfilled under Adams, they're still unfilled. And now we're looking at the prospect of more cuts. How will you, as the city council, how are you going to work with this mayor this budget cycle?
Well, thank you so much for the question. And let me just say, Senator Batcher, we miss you in the city council. Our loss is Albany's gain, and we wish you the best of luck, but it's great to see you. So this budget dance question is a very interesting question. I have been in government a long time. I've run 3 city agencies as commissioner. I've seen many different relationships between mayors and speakers over the many years. The whole idea of the budget dance is somewhat problematic because it really puts everyone through this back and forth, back and forth, back and forth. And it's something actually I've spoken to the mayor about. We want to make sure that we are not putting New Yorkers through any kind of drama, any kind of back and forth that we don't need to do that. We want to be upfront, clear, transparent about where things are at and what the priorities are. And I'm confident that we'll be able to have that collaboration and do that. And I think that's really important. What I'm focused on in particular in terms of the council is we're looking at savings. So for example, I've been focused for a long time on the long-term use of no-bid contracts where cities suspend competitive bidding and it drives up the costs. We saw that during COVID where the city suspended the use of no-bid contracts over 100 times to the tune of $7 billion and it jacked up the price of PPE. We saw it in the last administration where during the asylum seeker crisis, no bid contracts were used, a $1.1 billion no bid contract to the Hotel Association, a $430 million no bid contract to DocGo, and we saw the results of this. So we actually are passing, and then these are bills that I had introduced last year, we're passing these bills that are going to cut down on that and could save the city billions and billions of dollars. We're also looking at cost savings around healthcare. We created, as you know, the Office of Healthcare Accountability, which
I voted for it.
Thank you. Thank you. And now the office is up and running at the Department of Health. And basically what that office does is it lists the price of every medical procedure at every New York City hospital because transparency matters. A woman who's giving birth by C-section at one hospital is paying $55,000 for that C-section. At another New York City hospital, that same C-section is $17,000. So I mention that because the city of New York spends about 10% of its budget on public sector and retiree independent healthcare. That's $11 billion that we spend. And 5 years ago, that number was $6 billion. It's almost doubled in 5 years. It's unsustainable. So we want to now harness our purchasing power to drive costs down. And so that is something that we are very focused on and could save the city billions of dollars per year. So we are laser-like focused on areas of potential savings. And let me turn it over to our finance chair, Councilmember Lee, to see if she's anything to add.
So looking at it from a cost savings perspective, so before my role on the city council, I ran a nonprofit organization, started a state licensed Article 31 clinic, which was one of the hardest things we had to do. Very eye-opening experience in terms of the whole healthcare system in general in New York State. And I think that's why, I know the comptroller mentioned it, but that's why we're looking at things like Article 6, right? Because even though that is $59 million that we're asking to restore, I think when we look at it from a savings perspective down the line, we know that a lot of those services that are paid for, it's all about prevention. And prevention is key when we're talking about keeping the costs in our healthcare system low for the city and the state. And so that's something else that I wanted to emphasize just to piggyback on that. And another thing we're trying to do is keeping the insurance companies accountable, which the speaker is starting an insurance accountability office or wanting to do that because This is something where, as a former provider, we're getting charged different rates depending on different private insurance companies. And there's no rhyme or reason to it. It seems more profit driven versus outcomes driven. And we need to start looking at the metrics to see, is this having a positive impact on our city and our community?
Does the council's finance division have an estimate of what the budget gap is? Is it 12? Is it 7? Is it something else?
So we are going to be releasing our projections in the next couple weeks. We believe very strongly that, first of all, Wall Street had a very, very strong year. And so including those bonuses that occurred at the end of December and going into early January is imperative for an accurate picture. We also believe there are additional savings that can be realized at various city agencies, because it's not just about the projected number of employees at any given agency, it's about the actual number of employees that are actually working at those city agencies. So we do believe there are going to be significant areas of savings, and we look forward to releasing our budget numbers in the coming weeks.
Thank you.